Now to the coronavirus in Chicago. We are getting to the facts of how the virus is hitting the area. Right now, doctors at the University of Chicago Medical Center are testing one person who has symptoms of coronavirus or COVID-19. Two people currently have it in the state. Several late developments tonight. We have team coverage on first responders and what the state is doing. Let's start there with CBS 2's Marissa Parra at the U of C Medical Center. Marissa.
Erica, no update just yet on that potential case of coronavirus here. We have seen a number of people walking past us with masks and protective gear. We did learn today, however, that the state is keeping a close eye on the availability of gear, such as those facial masks and such as the protective gear, as well as logistics like hospital bed availability throughout the state. We've also learned that tomorrow they're going to ask for more money from Washington. Preparedness was the topic of today's state public health hearing, but it's hard to prepare for a virus you've never seen before.
We have been doing regular webinars with hospitals, hospital leads, and hospital administrators throughout the state. We have been talking through issues and protocols.
Dr. Ezike with the Illinois Department of Public Health says they're preparing guidelines for not just hospitals, but schools, universities. We've learned that unlike the flu, current trends with coronavirus show children might not be as at risk as the elderly, but there's still a lot we don't know about the virus. Out of 116 people who have been tested for coronavirus in Illinois so far, 22 results are pending, including one possible patient at the University of Chicago. Out of the 4 positive results so far, the third and fourth were announced in the last few days, a husband and wife in their 70s. Health and Human Services promises tens of thousands of testing kits to states around the country, but it's not known how many kits will go to Illinois. Those new testing labs in Carbondale and Springfield are up and running. Right now, Illinois has roughly 2,200 testing kits. On Wednesday, Dr. Ezike will be lobbying in Washington for more testing kits and more funding to allow everyone to be prepared.
Might also contain compensation for persons who were isolated for 14 days, who were asked to stay home and lost wages and incurred health care costs.
And when it comes to preparedness, IDPH says it's never a bad idea to stockpile on basics like food, toilet paper, and bottled water just in case. Dr. Ezike did say that when it comes to addressing the possibility of temporarily closing schools or business, they're going to take that on a city or county level. So in essence, if it comes down to the fact that there end up being hotspots of coronavirus within the state, then yes, teleworking or e-learning would be a possible solution for those specifically affected cities or counties. Live from the University of Chicago, this is Marissa Parra with CBS 2 News. Brad and Erica.
All right, Marissa, thank you.